HIV/AIDS, modes of transmission, types of blood tests, prevention and care for HIV/AIDS patients. HIV lives in the human body, mainly in the body fluids and secretions, that is, blood, semen, vaginal excretions and breast milk. HIV concentration is more in the blood, followed in order by semen, vaginal excretions and breast milk. HIV can live for only 15 to 30 seconds outside the human body. However, the secretions and body fluids like saliva, tears, sweat, feces and urine have negligible HIV concentration and cannot transmit the virus from one person to another. HIV spreads from an infected person to another by four main routes. Sexual mode of transmission is the most common route for the spread of the infection. The risk of acquiring HIV infection is very high in case of unprotected sex and even higher in the presence of sexually transmitted diseases, STDs. Transfusion of HIV-positive blood from the infected person to another leads to 100% transmission of the virus into its new victim. The virus can also be transmitted from an HIV-infected mother to her child during pregnancy, delivery, or breastfeeding. Chances of transmission are also high in case HIV-contaminated instruments like syringes, needles, surgical or dental instruments are being used. Contrary to what people may think, HIV is not spread through sharing food, touching, hugging, kissing on cheeks, shaking hands, sharing toilet seats, taking care of someone with HIV or AIDS, sharing belongings, and through mosquitoes or other insects. An HIV-infected person looks as normal as any other healthy person, which makes it impossible to recognize him merely by looking at him. Generally, there are no external symptoms during the first 5 years of HIV in the body. The only reliable way to know one's status is by a blood test. There are 3 types of blood tests: ELISA, enzyme-linked immunosorbent assay, Western blot test, and PCR, polymerase chain reaction. These tests detect the presence, absence of antibodies to confirm the HIV positive, negative status respectively. Everyone can protect themselves from HIV infection by adhering to healthy practices. Undesirable sexual practices among people are responsible for 91% spread of HIV. One should thus practice safe sex, that is, use condoms to avoid HIV infection. Other preventions include giving adequate medical treatment to the infected pregnant mother, which can protect the child from contracting HIV. Transmission of the virus can also be prevented by ensuring that the blood used for transfusion is HIV-free and by using disposable syringes or sterilized needles. seeking immediate treatment for STD along with a sexual partner can also help in avoiding worse circumstances. There is no remedy for HIV/AIDS at present. Once the virus enters the body, there is no way to eliminate it. There is treatment only for the secondary infections. There is an antiretroviral therapy during HIV infection to combat the viral load in order to prolong the life period. It is very expensive and also has several side effects. Home is a very important place for a person suffering from AIDS. In the presence of a caring and loving family, such people can emotionally cope up better with the disease. Since there is no cure for the disease, giving such people enough care and moral support is the least that can be done. Children with HIV/AIDS need nutritious food and a clean environment. These children should also be given immunization like other children. Whenever children show any signs of ill health, they should be immediately taken to the doctor. HIV cannot spread through a child's urine, feces, saliva or vomit. A child with HIV cannot infect others by playing with them. Children with HIV should be allowed to live a normal life. They should be allowed to attend school as long as their health permits. They need a lot of love and care. Thus, AIDS is a disastrous disease that has still not met its remedy. People succumb to it every year all over the world. If we cannot fight it, the least we can do is try and stay away from it.